These are the two bones in your forearm. Which one is radius? The top or the bottom? Bottom one. That's your radius. It has a nice round flat head. And what about the other one? Ulna, if you see carefully, it looks like a wrench. See, this portion looks like a wrench, head of a wrench. And also if you see the notch there, it has the shape of U. U for ulna. Don't miss it, Sheldon, please. I'll deduct more points if you miss the ulna. Okay, coming to the radius. That's your head of the radius. What is this rough area? Tuberosity. So what tuberosity? It's the radius, so radial tuberosity. And at the very tip you have a little stylus-like projection. That's your styloid process. It's more prominent on the ulna than the radius. You can see a closer view of the head and the radial tuberosity. That's your styloid process. And now looking at the ulna, head of the ulna, you have the notch. This notch goes and articulates with the trochlea, so they call it ulnar or trochlear notch. And these two processes also articulate with the fossa in the front and back, meaning anteriorly and posteriorly. So depending on the fossa where they articulate, they call it coronoid process or olecranon process. Everybody got that? Cool. Okay. So next we are going to do the hand. So how can you tell if you see a pair of hands like this, okay, which is my right and left? Look for the thumb, okay? The thumb has only two flanges, unlike your other fingers, right? So this is your left, that's your right. And also to tell which is the anterior or posterior side, if you look at the wrist, you'll see the hamate has a hook, the hamulus. That tells you that's your anterior side, and the other side is the posterior side, okay? And we are going to number the bones. Okay, we have names for the carpal bones, and we have numbers for all these bones, numbers and names. So the numbering starts from where? The thumb going this way. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. And we have to use the Roman numerals like this. 1, 2, 3, 4, 5, like a V. Okay, don't use the regular 1, 2, 3. Always use the number and then say what it is. So what would this be? First metacarpal bone, but you have to write that. Fourth metacarpal. Now if we do the phalanges, remember the orientation, your hand grows like this, so the proximal will be here, distal will be further away, proximal, middle, distal. And remember, middle is different from medial. Medial meaning towards the midline. Middle meanings between two things. So here we say middle, not medial. So first proximal phalanx. Phalanx is singular. Okay, phalange is plural. First distal, don't forget the number. Third, middle phalanx. All the way on the top. Fourth, first distal phalanx. Okay, so everybody got that? The carpal bones are going to be a little hard. You can use either mnemonics, or some of us look for the shape and the structures. Like the hamate, you can tell right away because it has the hook called the hamulus, tiny projection on that bone. The pisiform looks like a little round pea seed, like little round, and and the scaphoid has a little S shape. That's your scaphoid. Triquetrum will be triangular. The trapezoid will have the shape of the trapezium. So you can see a closer view. See, this is your pisiform. You see, nice little round, looks like a pea seed. When I say P, P-E-A, P. And this is your scaphoid. You can tell the hamate from the hook. That's your hamulus of the